tuned to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Podcast. Jeannie Roller and I are talking today as a continuation about the infections and what is all going on in the hospitals with the stuff that people can get that isn't from anything that they had their surgery or their procedure for, and you know, what all that means. How can we stop it? Are there tests? There's got to be different... Jeannie, there's got to be different scenarios. What am I trying to say? A checklist that says, were these things done in the OR? Were these things done in the operating sphere? What's going on with this? It can't just be willy-nilly and, you know, the guy comes in with his gloves already on and he's opening up all the doorknobs and everything, and then the woman or whoever is going to work on you, and the gloves now aren't sterile any longer. I ran into that myself with a procedure for someone that I knew, and the doctor was talking with this person throughout the procedure that, do you realize that those gloves now aren't sterile any longer? He was saying to the assistant, because you've touched the garbage can and you've touched this. And I'm like, oh my goodness, please tell me that these people do know this stuff. And this was a procedure that somebody I know, it's valid that they were saying, yeah, the doctor was phenomenal, the nurse was phenomenal, but this other one that was like on the outside of this surgery center kind of room, because it wasn't a hospital, it was in a surgery center, didn't know. They didn't have a clue that the gloves, if you touch the doorknob, if you touch the garbage can, now those gloves now are no longer sterile. Then you need to wash your hands and change the gloves. So please tell me this isn't true. Jeannie?
Well, I wanted to talk first about who is more susceptible. And, you know, the very young, the very old.
Okay.
People who have undergone recent surgery. People, and that would include women who have just given birth in the hospital. Mm-hmm. So, I mean, that's scary too. You know, people who are cancer patients, people who have diabetes are also at elevated risk. Those with compromised or impaired immune systems, such as HIV positive patients. I mean, so there's a whole spectrum of people that are susceptible to getting hospital-acquired sepsis.
More susceptible.
And,
yeah.
And some of the symptoms that needs to be looked at are elevated heart rate, fever and shivering, confusion, hypotension, low blood pressure, sweating, shortness of breath, extreme discomfort. So, I mean, when someone presents at an ER with some of these symptoms, why automatically are they not doing? There's a test that they can do, and it is called SIRS, SIRS. And what it is, it's to determine if they have sepsis. And they have to meet at least two of the criteria items: temperature of over 38 degrees or under 36. And I'm assuming that's Celsius.
Yeah.
A heart rate of over 90. Breathing rate of 20 or under per minute, and a white cell count of over 12 taken from a standard blood test.
Yeah.
And so there is a protocol in place to test, but, you know, in my opinion, people aren't trained, or maybe the ER is not well enough staffed. I don't know what's going on, because I've heard too many stories, as we said in a previous show, of people going to the ER, presenting these symptoms, and not having the appropriate tests done.
Right. You gave the statistics in the other podcast that we did on how many people. I think it was like almost 750,000 people. No, 250,000 people that are dead from this a year.
Yeah.
If I remember correctly, there's a lot of
270.
Yeah, the lot.
270,000.
One person is too many. But how many times and how many stories have you heard, Jeannie? I know I can't even count them. That the person goes to an ER situation, and I know it's a split-second decision. I get all that. And we're all on board on all of that. This is not like, the bad guy, but that this gets like gone by the wayside. Like, yeah, it can't be that. It's not that. When it could be that, simply that. Yeah, things are going to get missed. Nobody's perfect. But is that a simple kind of blood test if you have all of those symptoms? How many people have been missed? You said that many.
Yeah.
That's a lot of missed people.
Well, I know, like in Michelle's daughter's case, she wasn't given the test.
Yeah.
Michelle asked for it, but
Yeah.
her daughter was never given the test.
There you go.
And treatment has to be early and quick, because sepsis starts shutting down organs.
Right.
Is what it does.
Yeah.
And, you have to catch it, and it has to be aggressively treated. And I just don't know what is happening. I think it goes back to a lot of things we talk about, Cindy. Training.
Yeah.
It's all about lack of training. It's like, the person you were talking about with the gloves. I'm
Right.
sure training covered that.
Or maybe not. I don't know.
Maybe
I don't know.
I would, ongoing training, it needs to happen. I know when I was in school, we were constantly retrained on things, and, to the point where it's like, oh no, not again.
Right.
But we kept getting retrained to recognize symptoms of bullying, etc. Recognizing kids who maybe were suicidal. I don't know. I can't say, but it seems to me that hospitals need to be a little more involved in getting training to people, because there's way too much of this happening, and sepsis is preventable. It's very preventable.
It is preventable. And you know what? One thing that comes to mind about this, and this has happened to me in different appointments that I've gone to with different doctors, and this never used to happen. Some of the people in my family were in the nursing profession, and one of the stipulations always was that you had to have really short cut fingernails. One of the things that I know when they scrub for OR, they scrub for what, 15, 20 minutes, a half an hour? It's a long time. And they're using all kinds of, bacterial kind of soaps and all this, and brushes and all this kind of thing. I see so often, continually, nowadays, women in medical settings, they are labeled medical assistants, which to me, the training is varied unbelievably from a day to maybe a weekend to maybe whatever. And they have on glue-on, press-on plastic nails that are more than a couple inches long. I've had people work on me. And I wonder if that's part of it, because I know for a fact that when you wash your hands for OR and specifically things like that, they're digging under their nails incredibly to get the germs and everything out, because fingernails are dirty. Your hands are dirty. I don't care if you're washing, especially the fingernails with the stuff underneath. And I've brought that to the attention of offices, to the doctor's office, going blah, 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 blah. And I remember one person telling me, I don't know who it was or where it was, but I remember the person telling me that legally they can't say anything. Now, I don't know if that's true or not, what the person said to me. Again, we're not doctors, we're not lawyers, but I have seen that where you never used to see nurses, men or women, orderlies, any of them, that had any length to their fingernails. They were always clipped very short, and certainly no polish, a nail polish or anything like that. And the other thing is there were no rings. If you had a ring on in the OR, that ring was just a wedding band, unless it was like a religious kind of a thing or something. I remember that. And the band was taped. There was sterile tape that was taped over it, and then you had the gloves on. Now, maybe that's too overkill, but I'm sorry, I don't want to use the word kill. But if it saves somebody's life, then why aren't we doing these procedures? Some of them aren't ridiculous. Some of them, they take a lot of work and they're a pain in the neck, but that's where you're saving people's lives. I'm just throwing that out from my own knowledge. On that note, stay listening to Evergreen Media Network.